And joining us now for this week's Your Health segment is Dr. Robert Shinn, neuro-ophthalmologist with the University of Maryland Medical Center and Associate Professor of Neurology and Ophthalmology at the University of Maryland Medical School. Doctor, thank you so much for being with us.
Thanks for having me.
We're interested in this because very recently Jack Osbourne, who's the son of Ozzy Osbourne and Sharon Osbourne, a young celebrity diagnosed with MS, and apparently the symptoms that sent him to the doctor started with his vision.
Right.
Is that uncommon?
That's actually very common. So multiple sclerosis is a disease that affects different parts of the nervous system, the brain, spinal cord, or eyes. But actually about half of patients will actually start with some type of vision problem. So it's actually very common that that's the first thing that brings someone to medical attention.
What happens? What happens to somebody's vision? What's maybe a primer on the disease itself?
Well, so multiple sclerosis is what we call a demyelinating disease. So our immune system might attack different parts of what the insulation around nerves. And our eyes have a lot of nerves. In order for us to see, the eyes, basically like a camera, will send that information into the brain. So you have a graphic here which shows the eye, and then there's a cable basically that connects the eye to the brain. And that can be a common target for multiple sclerosis.
What happens in the course of an MS attack, and is it permanent?
Well, people can experience a lot of different things. If it is visual, people may have blurred vision or loss of vision in one eye. It's also possible that people might experience double vision, so they see more than one image. On the other hand, MS can affect other parts of the brain as well, so it can cause weakness or numbness. It can cause pain sometimes, or bowel and bladder difficulties. Fortunately, the symptoms often are temporary, so they can recover from the episodes. But even the name multiple sclerosis is because people have multiple different episodes, and over time that can lead to a lot of disability if untreated.
Particularly scary disease with a lot of well-known people who suffer from it, including Ann Romney, the wife of Republican presidential candidate Mitt Romney. There is some good news, though, in terms of new treatments for this. How has your arsenal of treatments changed lately?
It's actually been very dramatic. So not long ago, let's say the early 90s, we actually had no treatments for multiple sclerosis at all. So actually when people hear about MS, they're often very afraid because their recollection might be a very devastating disease with no cure, no treatment.
You'd hear about steroids, maybe.
Maybe steroids to sort of temporarily help, but nothing that really helped in the long term. So over the past 20 years, we've made actually a tremendous number of breakthroughs. We actually have 8 different brands of MS medicines that have been approved by the FDA. Many of the early medicines were injections. Within the past year or two, we've had our first pill developed for MS. So the ability to fight MS has changed dramatically. What we've recognized is that the earlier people are identified as having MS, and the sooner we start treatment, the better they do.
Do you believe that you can change the trajectory of the disease over somebody's lifetime? Yeah,
absolutely, and that's why, for instance, you mentioned steroids, which we still use today to help people in the middle of an attack. But the medications I mentioned that are FDA approved, we actually call them disease-modifying therapies because when we compare people who did not have medication to the people on the medication, we see that they have less disability, less attacks, less symptoms over time. So they truly alter the course of the disease during the lifetime.
Why are there attacks? What causes one?
Well, that's a great question. We don't actually know. We don't know what the cause of MS is. We know that it's very common, especially here in the U.S. You mentioned there are a lot of celebrities with MS. You mentioned Ann Romney. Michelle Obama's father has MS. People may remember Annette Funicello, Richard Pryor, Montel Williams. There's a long list because about 1 in 1,000 Americans has MS. So almost everybody knows somebody probably who has MS, actually.
Is that a different number than the rest of the world? Is it a Western thing?
It is, actually. So the highest incidence of MS seems to be Europe and the United States and Canada. There are a lot of theories about why that might be. It could be because the U.S. and Canada is made up of descendants of Europeans for the most part. Some people have theorized it's because we're in the more northern latitudes, and that could be anything from climate to sun exposure. You hear a lot about vitamin D. levels. Some people think it's an infection that we haven't identified yet. There are many theories, but absolutely different parts of the world are more at risk. We're kind of at ground zero for MS here in the United States.
How do you diagnose it? If somebody comes in and is a vision complaint a typical complaint, but whatever it is, somebody comes in, what happens at the doctor's office?
So if someone has an initial event, whether it's visual or a spinal cord problem, we call that transverse myelitis, or some other event, they often get examined by a physician or a particular neurologist looking for different abnormalities on their examination. They often pair that with imaging. So MRI, which we use increasingly frequently, has been very helpful because it can identify the spots or plaques or lesions of multiple sclerosis early on in the course of the disease.
I think we may have a picture of what a lesion looks like, but when you have a slide of the brain, basically it shows up as a bright area.
Correct. Yeah.
That's it over there?
Yeah, so if you were to look at this image, this is a horizontal slice through a patient's brain, and what you can see in the center of the brain are these kind of bright white spots that are jumping out at us a little bit. And these are areas of inflammation or demyelination. You shouldn't diagnose MS purely by MRI. It's very helpful to have a clinician examine you, find out your history, what kind of symptoms have you had, check your neurologic exam. But MRI is very important, as I said, in kind of confirming the diagnosis of MS and helping to identify it at an early stage.
Let's take a phone call. This is Michael in Anne Arundel County. Michael, thanks for the call. Go ahead.
My question is about causes of MS, not about the ophthalmological relationship per se.
Sure.
But about 5 years ago, I read in Johns Hopkins Alumni Magazine that one of their young, brilliant students that they occasionally bring in for summer things, had mapped the incidence of MS and overlaid that with the incidence of Lyme disease, and they said they were startled to find some correlation, and I wondered if there was any truth in that and whether that has been explored further. Thank you.
Michael, thanks for the call. You said there's a potential for it being an infectious...
Absolutely. So there's a lot of interest in finding out what the cause is, but there are also a lot of associations. So people are interested in Lyme disease. I would say that though that initial interest had been there, that doesn't seem to be panning out. It overlaps a lot, though, because Lyme disease is very common in certain parts of the U.S. and in New England, where MS is more common. Certain viruses, something we call HHV6, is being explored. Even things like Epstein-Barr virus has been looked at. Unfortunately, we've never found any conclusive proof to one-on-one link any one infection with the incidence of MS. So I think it's more research that needs to be done. People are interested in the genetics of MS. You know, could there be a relationship to your genes, or might you be more susceptible to MS based on what you've inherited from your parents? So there are a lot of questions.
Women are more susceptible somehow, right?
Absolutely. So it's been observed that women are maybe 2 to 3 times as likely to get MS as men are. Plenty of men have MS, but it is more common in women. We know that the age range, it usually affects people in a young age range, from the typically ages 20s, in their 20s to 40s. So there are a lot of questions. Why would a disease affect someone really in the prime of their life? I mean, that's really certainly a big question.
Does it wind up getting misdiagnosed, you know, on the first pass often? It
can be difficult, and some patients are frustrated because they might have seen many physicians before a diagnosis of MS is made. Part of the problem is that because MS can affect so many parts of the nervous system, the symptoms are not very specific. Blurred vision, numbness, tingling, weakness, these are symptoms that can occur for a lot of different reasons. So it really does sometimes take an expert to sort it out and rule out the other possibilities until we're left with a diagnosis of MS.
And the takeaway here is that if you think you might need to get checked out, because there are drugs that can actually change the course of the disease.
Absolutely. We definitely, as you had said, the earlier people are identified, the better they're going to do. The sooner they can get on treatment, the better they're going to do.
All right, Dr. Robert Shin with the University of Maryland Medical Center, University of Maryland School of Medicine, thank you for being with us.
Thank you.
Thank you for joining us for Direct Connection. We're back Thursday with Your Money in Business. Have a good night.